But it depends on people, so now it's a question of judgment. And I also believe that it's a question that parents can manage together. There is no miracle recipe, you know, like pandemic, like these ones, we haven't experienced them. We haven't made any studies. And I think that people are sufficiently intelligent to understand. What we mean to say is that young people shouldn't, go have a party and when they're with one parent and then they go back to their mother and they contaminate the mother and the grandmother, you understand? I think that we have to depend on people's good judgment.
Il y a beaucoup d'inquiétudes.
There's a lot of worry in the healthcare network. You're conscious of it. I'm sure that you are probably overwhelmed with emails. What is being said is that the guidelines are not the same from one region to another, from one hospital center to another, particularly for the N95 masks, the ones that protect the best. Are there enough for all regions? Yes, there are enough for all regions.
Okay, we're going to pull away from that Quebec briefing to bring you to Ontario. Both Quebec and Ontario seeing a high number of cases, and the Premier expected to make an announcement today about hydro rates. Let's listen in to Premier Doug Ford.
Remain open. And our officials are working with businesses across the province to give clarity. What may not seem essential to downtown Toronto or urban areas may be essential to rural Ontario, and the same goes for the other way around. I just got off the phone with the leaders in the construction industry. We're working with them to ensure the well-being of workers. Across the province, thousands of families are waiting to move into new homes that are days or weeks away from completion. When it comes to necessities of life, shelter is at the top of the list. And we cannot take lightly a decision that could put shelter for thousands of people at risk. Yesterday, I put the construction industry on notice. Our Chief Prevention Officer has sent out new guidelines for construction sites. And there are currently dozens of provincial labor inspectors at numerous large job sites to ensure appropriate protocols are in place. These inspectors will not hesitate to shut sites down. Let me be clear. If the industry does not take every step necessary to look after their workers, I will shut them down. Because this is the first and foremost a public health emergency. A public health comes above all else. Shutting down non-essential workplaces was a necessary decision, and we will not hesitate to shut down further workplaces as needed. We need to do everything possible to slow the spread of COVID-19. As a society, we're being asked to make tremendous individual sacrifices. To get through this, we must all make sacrifices. We must put our collective well-being above all else. And today, we're recognizing the sacrifice that people and businesses are making during these difficult days. We're taking a necessary step to provide some certainty for small businesses and some relief for families. We know this is a challenging time for all Ontarians who are doing the right thing by staying home. We realize this means people are using more electricity during the day. To help family and households across the province, we're switching to off-peak time of use electricity rates, saving customers over 50% compared to peak rates for the next 45 days. We also know many small business owners and farmers who are providing non-essential services are worried about paying the bills. I'm pleased to announce small businesses and farms will also be eligible for these reduced rates. This means you will pay the lowest rate possible 24 hours a day, 7 days a week. You won't have to do anything to receive the savings. The new rate will apply to the power you're using today, right at this moment, and for the next 6 weeks. There are no complicated applications or waiting periods. The savings will simply show up on your next bill. We're leaving more money in people's pockets, money that you can use to take care of your family or strengthen your business. We're also providing more flexibility for people to work from home, take online courses, do the laundry, or run the dishwasher instead of waiting for the evening to come around for off-peak hours. We're making things a little bit easier during some hard times and supporting everyone out there who is following the rules and doing their part to stay home. I also want to mention that our government is helping out our truck drivers who are keeping our supply chains running. We'll be keeping en route locations and other rest areas open so drivers can refuel, order takeout, and can get a break. And we're stepping up disinfection and cleaning at these facilities to keep everyone safe and healthy. And we're using Ontario's electronic highway signs to remind people to stay home and only travel when it's absolutely necessary. We're thankful for everyone who's doing their part to stay home and practice physical distancing, keep our province running, and help everyone stay safe and healthy. You're doing the responsible thing. Your actions are making a real difference. Simple actions like these will go a long way in stopping COVID-19 and flattening the curve. And now I'd like to invite Minister Rickford to share more details about the announcement and the work he and Minister Walker are doing to secure our hydro networks.
I want to thank you, Premier, for your leadership, and I'm pleased to be joined by my Cabinet colleagues, especially Minister Bill Walker, who's been a great help on this initiative. In fact, I want to thank all of my Cabinet colleagues, and in particular my caucus colleagues who've made important contributions to the relief we are providing Ontario families here today. This announcement represents an investment of over $160 million to hold time-of-use electricity rates to the off-peak price for 45 days. Starting today, right now, all customers who are currently billed under time-of-use pricing will be charged the off-peak rates of 10.1 cents per kilowatt hour at all hours of the day. No action is required from electricity consumers. This change will happen automatically for everyone who is paying time-of-use rates. Minister Walker and I have worked closely with the Ontario Energy Board, the Independent Electricity System Operator, and local distribution companies across the province to make this happen. And I thank everyone for their tremendous efforts. Our government continues to listen and respond to your concerns during this difficult time. We are making this investment to provide needed relief to Ontario families and businesses who are doing the right thing by staying home. We know that small businesses, whether open or closed, continue to have electricity costs and need help during this difficult time. Finally, I want to take this opportunity to assure Ontarians that our energy sector is strong. Ontario is well equipped to provide us with a reliable supply of electricity in any situation. We have world-class electricity operators who are maintaining our strong grid supply and ensuring workers are taking appropriate health and safety precautions. Et maintenant, je vais vous présenter les détails en français. Nous avons écouté les peines des Ontariens et des Ontariennes et nous comprenons que rester à la maison entraîne une hausse de la consommation pendant le jour. Nous comprenons aussi que les PME, ouvertes ou fermées, doivent continuer à payer leurs facteurs d'électricité et ont besoin d'aide pendant cette période difficile. C'est pourquoi, dès aujourd'hui, à minuit heure de l'Est, les Ontariens et les Ontariennes vont payer le tarif applicable aux heures creuses en tout temps, soit 10,1 cents par kilowattheure. Cela s'applique à tous les ménages, les fermes et les PME qui paient actuellement en fonction de l'heure de consommation. Nous allons maintenir cette tarification pendant une période de 45 jours pour soutenir les Ontariens et les Ontariennes pendant la pandémie de COVID-19. Les consommateurs n'ont aucune mesure à prendre. La tarification
Consumers
réduite
don't have to worry
s'appliquera
about anything, says the
automatiquement sur
minister.
les
This will
facteurs
happen
de
automatically
sécurité
on your hydro
actuellement en
bills,
fonction de l'heure de consommation.
and it will
We must
become
all
the
do our
off-peak
part during
rates.
these uncertain times. Last week, we took immediate action to ensure that no family or individual will have their electricity disconnected during the COVID-19 outbreak by implementing a ban on any disconnections from electricity or natural gas supply across this great province. And today, we're proud to invest in additional electricity relief for the people of Ontario. Thank you. I'll turn it over to the Premier to take questions.
Okay, we'll move to the phone line. First question.
First question comes from Travis Dunrush of Global News. Please go ahead.
Afternoon, Premier.
Hi, Travis.
Question for you. One's kind of broad, the other one's more specific. And I know this is a difficult situation for everyone, but right now we have doctors from 5 hospitals on social media that are begging for personal protection equipment. Why is that happening in one of the richest economies in the world, considering what this province went through during SARS? Why weren't we properly prepared for this pandemic?
Well, I'll answer it, and then I can pass it over to the Minister of Health. We have all hands on deck, making sure that we can secure a safe and supply of health products that will make sure our frontline healthcare workers are safe. We are on the call, day in, day out. Again, last night I was on with our procurement folks at 11 o'clock at night. Again, first thing this morning. Everyone is out there going full steam ahead, making sure that we can acquire the masks, the ventilators, other items that protect the frontline healthcare workers. We're seeing light at the end of the tunnel. We're getting more masks. We have, as I mentioned the other day, there was 12 million gloves on order and coming in. So if they're short, we are going to make sure over the next day or so that we're going to fulfill the requirements. And Travis, I got to give a shout out to the private sector. A gentleman by the name of Jeff Kenyard, the CEO of Home Depot Canada, called me up out of the blue and said, Doug, I have 20,000 N95 masks, and Home Depot would like to donate it to our frontline healthcare workers. We thanked them. This is the generosity of the private sector, that people are stepping up, donating masks or any other items that the frontline healthcare workers are using. So it's a shout out to Home Depot. I thank you. I thank all other businesses stepping up to the plate. Those 20,000 masks will be distributed in the next day or so. As soon as we receive them, they're being shipped over today, he told me. And we're going to make sure those 20,000 masks out there. I'll pass it over to the Minister of Health right now.
Thank you, Premier. We do have an adequate supply of personal protective equipment for all hospitals, all frontline health workers. At the moment, we want to make sure that everyone who is either testing or working with people with COVID-19 are properly protected. We need our frontline workers to be protected, to protect their own health, the health of their families, and the health of the people that we're working with. That said, we have heard from several areas that they are running short on supplies, and we were providing them with supplies as soon as we hear of their needs. We are dealing, I think it's fair to say, with an international competition for personal protective equipment, but we are receiving our supplies in, and we are working with local Ontario companies. I share the Premier's respect, and we're very grateful for the work that's being done internally to work with automotive part manufacturers to help us to produce more ventilators, with other companies that are producing gowns and masks. The supplies are coming in. This is what I spend a good part of my day on, is working with Ontario companies and trying to move this forward as quickly as possible. But we currently do have the supplies that we need.
Okay, Premier, just more specific.
Travis, let me just elaborate on this until people can get the perspective. When we talk to their distributor for Canada, or we talk to 3M directly, these N95 masks are coming from Singapore. They're coming from the UK. They have one plant in South Dakota that all of America is drawing on. The UK plant, under the European Union, they will not give North America the masks. So we're doing everything we can to make sure we have a supply on hand, put repetitive orders in for 1 million masks, a blanket order for 2 million, and we're making sure that our name's on the list. I was on the phone yesterday with 12 other premiers and the Prime Minister. Everyone's facing the same challenges. Talked to Premier Legault this morning. He's facing the challenges as well. But as the Minister of Health said right now, we have the supply, we're getting more, and we're doing everything we can. That is what we are focused on 100%.
And Premier, I have a specific question on a certain situation. I'm doing a story tonight on a group of 6 Ontarians that are stranded in Cusco, Peru. There are flights that are going to that country over the next few days, but right now there are none that are going to Cusco, and they can't get to Lima, which is 5 hours away. They are scared. They are running out of medications. Have you spoken to the Prime Minister about this, and what would you tell these guys that are going to be watching this story tonight directly?
Well, Global Affairs is working on that situation along with others. I'm going to tell you good news. Remember the group from Peru? With the cooperation of Global Affairs, the federal government, and Air Canada, they're back home. So that's fabulous news. I don't look at jurisdictions, even though it's a federal jurisdiction. Let me be very clear to all construction workers. We passed legislation, not just construction workers, any worker in Ontario. If you don't feel safe in your workplace, your job will be protected. You can leave the job site. I had a discussion with labor leaders. I've had a discussion with some of the largest contractors in the entire country saying, get your act together. I have zero tolerance for sites that have overflowing outhouses, don't have hand sanitizer, have running water. And a couple comments from them is, one person told me that the construction folks are taking the hand sanitizer out of the outhouses, and another person made a good point. Well, you know something, with all the water we have in this country, there's no excuse for these general contractors to have water and soap there. We will not hesitate. We have inspectors all over these sites right now as we speak, and we're going to continue day after day inspecting these sites, and they have the authority to shut down any site in the province. And we want collaboration, we want cooperation. Vast majority of these general contractors, vast majority of these labor leaders are cooperating. They're doing a great job. There's some bad actors out there that are causing a problem for the whole sector. And again, if you go on site and you don't feel it's safe, then you can walk off, you can contact your union leader, your rep, but they need to make sure they follow the guidelines. We will not hesitate to shut these sites down, as our list shows, and there's an endless list, and I understand there's lists, and I'm probably going to get a few more questions about that list. And saying that, we've had tremendous cooperation from the people right across this province. All you have to do is, I'm talking for Toronto, you just drive down here and it's like a ghost town. So people are cooperating, people are listening, and we appreciate it. But they also, businesses, they have to use their judgment and their common sense. We can't, go around and inspect tens of thousands of businesses if someone's working at a location. And again, I repeat, you don't feel safe, you walk off the site, you can call the Ministry of Labour as well.
Next question.
Thank you, Minister. Thank you, Premier.
Thank you.
Next question comes from Laura Stone of the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
We're seeing some restrictions on interprovincial travel in Nova Scotia. I'm wondering if Ontario is considering closing provincial borders to non-essential travel or requiring self-isolation for people who are crossing into Ontario.
Well, again, great question, Laura. I had that conversation with Premier Legault. It's a vast border. And again, we're hoping and praying that people are listening. And if they don't have to travel, do not travel. It's absolutely critical. We can't stress it enough. And then people coming from abroad, landing here, it's concerning that people, I've heard stories even this morning. They land, they go to the hotel last night, and bang, they're back on another flight. And then that's understandable if they're traveling from point A to point B, and the only landing spot is in Toronto. But in saying that, please, when possible, stay at home. I saw a video the other day, and I might have mentioned it yesterday. I couldn't believe my eyes. People in Mississauga, and I'm not pointing out Mississauga, it just came from Mississauga. I'm sure it's happening some other places. You go to the playground, and there's half a dozen kids all going on slides, playing with each other, touching it with the parents.
solely focused on COVID-19 and in particular additional resources for the healthcare system?
Along with the Prime Minister, the fiscal capacity of the province is not the same fiscal capacity of the federal government, plus the distribution of funds, and we don't want to duplicate. I was pushing hard to make sure we increase the funds that would be going to individuals. That was one of my questions, along with the other premiers, to the Prime Minister. Prime Minister is doing a great job working around the clock, along with the Deputy Prime Minister. I want to thank them. They're doing everything they can, and that was a question we posed. We're going to be following up, but I'm going to pass this over to the Minister of Finance.
Thanks for the question, Laura. The province of Ontario, first and foremost, is responsible for healthcare, so there will obviously be a significant focus on the response to COVID-19 and the healthcare components of that. But this will be the first steps in our plan to respond overall. So there'll also be support for businesses. But as the Premier has said, we are concerned about making sure that we're delivering the healthcare resources. We're concerned, and you saw today with the announcement with regards to time of use, that's money into people's pockets, and we are concerned about making sure we are supporting the business community as we can. But as the Premier has said, the federal government, and I think we complimented them last week, has stepped up with the direct support for individuals, with the income transfers that they've talked about, the expansion of the EI program. So our program tomorrow will represent that first step that allows us to make sure that, first and foremost, the healthcare system has the resources it needs, that we are have supports for people in the economy, but they're complementary to the significant effort the federal government's been making, and I think all governments, local, provincial, and federal, will continue to look at the situation as it evolves and make sure the supports that are required are there.
Next question.
Next question comes from Sean Jeffworth of the Canadian Press. Please go ahead.
Good afternoon.
Good afternoon, Sean.
Good afternoon, Premier Ford. Just wanted to ask you about your announcement today on time of use, specifically about the timeline that it will be in place. I understand it's 45 days. I'm wondering if that is an indication that the province thinks that people will have to stay at home for that length of time, and that this COVID-19 response is going to take that long to potentially resolve itself.
Well, thanks for the question. Before I hand it over to the Minister of Energy, we're just trying to take a little bit of the burden off the backs of people that have to stay home, that may want to do their washing or using more electricity. And when people are at home, they will be using more electricity opposed to when they're at work. So we just want to take a little burden off their backs, have the flexibility. I've said even during the election, Sean, I'm not in favor of this. We're spending well over $5 billion subsidizing people's electricity bills here in Ontario. We inherited the mess, and I'm not going to get deep into the weeds on politics. We inherited a real mess, and this is costing us another 160.
Good afternoon, everyone, and welcome to today's update on COVID-19 in New Brunswick. Bonjour tout le monde.
Good afternoon, everyone, and welcome to this update on the COVID-19 in New Brunswick. Today's speakers will be the Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs.
For the province today are the province's Chief Medical Officer of Health, Dr. Jennifer Russell, and Premier Blaine Higgs. Dr. Russell.
Good afternoon, everyone. This is a difficult time for all New Brunswickers, and we are confronted with an unprecedented challenge, and we are all being asked to respond with new routines that are unfamiliar and sometimes confusing. But bear this in mind. As you adjust to our new reality, the power to slow the spread of COVID-19 so that our healthcare providers can manage this illness rests with you. We are all doing our part by practicing social distancing, that is a physical distancing and maintaining self-isolation when we are directed to do so. We can flatten the curve and reduce its impact on New Brunswickers. And by flattening the curve, again, that just means slowing the rate of transmission, slowing the effect of this and the impact on our healthcare system so that we can cope with this. Today, I want to talk about what self-isolation is all about and how we can practice it effectively. First, there is one new confirmed case of COVID-19 to report today. This patient is between the ages of 20 and 30 in Zone 1 in southeastern New Brunswick, and this patient recently returned from travel. We now have 18 cases in New Brunswick, all confirmed, as we now are able to provide final confirmation from tests conducted at the Dr. Georges Dumont Hospital Laboratory, as I reported yesterday. 2 of these cases have required hospitalization. One in Zone 2 in the southern part of the province, and one confirmed case was hospitalized briefly and then has been discharged in Zone 3 in central New Brunswick. And there's a patient whose condition is being evaluated. So again, all confirmed cases to date are people who either traveled outside the province or are a close contact of a confirmed case involving international travel. We have not yet seen cases of community transmission, where a case emerges with no clear link to a known source of infection, but we must be ready when this happens. Aujourd'hui, je veux vous parler de ce que signifie l'auto-isolation.
Today, I want to talk about what self-isolation is all about and how we can practice it effectively. First, there is one new confirmed case of COVID-19 to report today. The patient is a female between the ages of 20 and 30 in Zone 1 in southeastern New Brunswick. The patient recently returned from international travel. We now have 18 cases in New Brunswick, all confirmed, as we are now able to provide final confirmation from tests conducted at the Dr. Georges L. Dumont Hospital Laboratory, as I reported yesterday. 2 of these cases have required hospitalization. In Zone 2, southern New Brunswick, one confirmed case was hospitalized briefly and has been discharged. In Zone 3, central New Brunswick, a patient whose condition is being evaluated. Again, all confirmed cases to date are people who either traveled outside of the province or are a close contact of a confirmed case involving international travel. We have not yet seen cases of community transmission where a case emerges with no clear link to a known source of infection. But we must be ready when this happens.
We are working to increase the number of COVID-19 tests to effectively capture those who may have the disease, those who have been in contact with cases, and those who are most vulnerable to its effects. This will provide New Brunswickers with important information to better understand what is happening in our communities. Our team is and continues to meet with our colleagues across Canada to ensure we have consistent and manageable approach to testing. What is most important is that we test the right people, which today means those with symptoms who have recently returned from travel outside the province. As of today, if you've traveled outside the province, you need to self-isolate for 14 days. We will have information on our website to capture the information around exemptions, and we also will have new information provided by the staff at 811. As we go forward, we will identify more contacts. As a result, more of you will be directed to self-isolate for 14 days and to be tested to determine if you have become infected. These measures will protect your family and friends from further spread of the disease. People are asking, what does it mean to self-isolate? What should I do or not do? What does this mean for my family and friends? The general rules of self-isolation are to stay at home, monitor yourself for symptoms such as cough, fever, and difficulty breathing, and avoid contact with others. If there are other people living in your home, they should stay in a separate room, use a separate bathroom if possible, maintain a distance of at least 2 meters or 6 feet away from others, keep interactions brief, avoid sharing personal items such as toothbrushes, towels, bed linen, utensils, and electronic devices. Those returning to the province from international travel should avoid contact with people and travel outside the province should avoid contact with people outside their families. They should not be getting their own groceries or other supplies. Have a friend or a neighbor do it for you. They will be happy to help. Those in self-isolation can step outside on their deck for a breath of fresh air, something we all need every day, without putting anyone outside their home in danger. For New Brunswickers who continue to play a role in flattening the curve, I thank you, and I want to remind you, you don't have to be completely housebound. Fresh air and exercise are the most effective way to prevent and manage stress that these conditions create. But be cautious, maintain 2 meters or 6 feet between yourself and everyone you meet, and avoid locations where people are gathering. Get outside to exercise, not socialize. Here are some further tips for families in self-isolation. At least once daily, clean and disinfect surfaces that you touch often, like toilets, bedside tables, doorknobs, phones, and television remotes. Avoid contact with individuals with chronic conditions, compromised immune systems, and older adults. Monitor your symptoms daily and use the self-assessment tool on the GNB website to determine your actions. If you develop symptoms, isolate yourself from others as quickly as possible and call Telecare 811. Les gens se demandent.
People are asking, what does it mean to self-isolate? What should I do or not do? What does this mean for my friends and family? The general rules of self-isolation are the following. Stay at home. Monitor yourself for symptoms such as cough, fever, and difficulty breathing. Avoid contact with others. If there are other people living in your home, they should stay in a separate room and use a separate bathroom if possible. Maintain a distance of at least 2 meters or 6 feet with others. Keep interactions brief. Avoid sharing personal items such as toothbrushes, towels, bed linen, utensils, or electronic devices. Those returning to the province from international travel should avoid contact with people outside their families. They should not be getting their own groceries or any other supplies. Have a friend or a neighbor do it for you. They will be happy to help. Those in self-isolation can step outside on their deck for a breath of fresh air. Something we all need every day, without putting anyone outside their home in danger. For all New Brunswickers who continue to play a role in flattening the curve, thank you. I want to remind you, you don't have to be completely housebound. Fresh air and exercise are the most effective way to prevent and manage stress that these conditions create. But be cautious. Maintain 2 meters or 6 feet between yourself and anyone you meet, and avoid locations where people are gathering. Get outside to exercise, not socialize. Here are some further tips for families in self-isolation. At least once daily, clean and disinfect surfaces that you touch often, like toilets, bedside tables, doorknobs, phones, and television remotes. Avoid contact with individuals with chronic conditions, compromised immune systems, and older adults. Monitor your symptoms daily and use the self-assessment tool on the GNB website to determine your next actions. If you develop symptoms, isolate yourself from others as quickly as possible and call Telecare 811.
Staying home will save lives. This is difficult for everyone, but we can get through this. Thank you. Merci.
Good afternoon. Bonjour. We are continuing to work with our federal and provincial colleagues to find ways to meet the challenges related to COVID-19. I spoke with the Prime Minister and my fellow premiers last evening. One of the topics of discussion was interprovincial borders. You can expect more measures in the coming days on that topic. As decisions are made and more information becomes available, I will share it with you.
As decisions are made and more information becomes available, I will share it with you.
I also expressed to the Prime Minister the need for consistency. We are seeing new measures being put in place each day, and those measures can vary widely between provinces and territories. We need a national plan that addresses travel between provinces. We need to ensure that people have access to a consistent level of health care across our country. We are concerned that personal protective equipment will not be available equally in all sectors. We must do everything we can to get money into the hands of those in need, and that all provinces will be able to respond quickly and effectively. We need to be able to answer questions about the EI program and address issues people are having in getting through to Service Canada. We must make sure that financial aid is available to small businesses. Enacting a national state of emergency is the best tool to ensure consistency across our country in the level of health care, safeguarding our supply chain, and in mitigating economic impacts. I did support this measure on the call last night, and I do support this measure. And this isn't about legislation to enact wide sweeping spending programs that was, I think, initially being proposed in the legislature in Ottawa today. But it's about having consistency. It's about ensuring we can all provide the very same quality of health care. We have the same supplies. We can supply the same level of protection for our workers. And we can continue to have measures that are effective by learning from each other. Having consistency across the country and coordinated measures will better allow us to safeguard our supply chain and food insecurity and help ease the variation in economic impacts across all provinces. Yesterday, we established a toll-free number and an email channel for people to contact us with their concerns. We heard from a lot of people looking for advice, and we heard about some situations that concerned us. For example, we heard about specific businesses that have continued to operate without ensuring the social distancing practices. That's a serious problem and a violation of the emergency declaration. Additionally, it puts us all at risk. We will follow up on each of these situations. We also receive reports of people returning to New Brunswick from away and not self-isolating, some returning to work even and some going to parties or social gatherings. This shows incredibly poor judgment and disregard for your fellow citizens and neighbors. Officers will follow up on every complaint that has specifics, and everyone who is in violation of the emergency declaration risks being charged. The business community in New Brunswick is facing an unprecedented level of uncertainty due to the effects of COVID-19 on their supply chains, logistics, absenteeism, and most importantly, on customer orders and sales pipelines. We believe that targeted financial support to some of these companies, in conjunction with the federal financial support to small and medium enterprises, will allow these companies to continue operating and employing New Brunswick residents throughout this crisis. As an immediate measure, we will, on a case-by-case basis, defer loan and interest payments for up to 6 months. This will enable businesses with existing loans from the government of New Brunswick to have immediate relief if they are experiencing difficulties as a result of COVID-19. To support our small businesses, ONB, through working with partners, will provide operating loans to support them. These loans will be up to $200,000, and payments of interest and principal will not be required during the first 12 months. These loans will provide targeted support to help companies to address the challenges associated with the crisis and to be able to rebound. ONB will also provide, upon request, working capital in excess of $200,000 to help mid to large employers to manage the impacts of COVID-19 on their operations. ONB will focus efforts on working with existing clients and clients that are traditionally eligible for ONB financial assistance in manufacturing, tourism, information technology, business-to-business sectors, and sectors supporting export activities. This assistance is complementary to existing financial support being made available by our federal partners and institutions, and will include specific criteria. More details will be available on the application process in the coming days. This is only a beginning, and it's a program that I'll be evaluating with my counterparts as we have our regular meetings to discuss the economic impact, the gaps that exist between the federal program and the gaps that we are able to react directly with and fill with the provincial program. We will closely monitor the situation and continue to respond as required.
This is a beginning. We will closely monitor the situation and continue to respond as required.
As well, we will provide a one-time income benefit to either workers or self-employed people in New Brunswick who have lost their job due to this state of emergency. This one-time $900 benefit would be administered through the Red Cross, and it will help to bridge the time between when people lose their employment or close their business and receive their federal benefit. Further details on how to apply will be forthcoming. As of today, we have moved 59 patients on the wait list for nursing home out of hospitals to nursing homes across the province. This allows us to keep our most vulnerable citizens safe while creating space in hospitals for those who may need it in the coming days. You can show you care by calling, texting, or using Skype or FaceTime to see how your loved ones are doing, but do not go see them in person. As a society, we need to keep each other safe, and today we will do that by limiting our outside contact. I encourage all of you to continue to listen to public health and to do your part as we endeavor to flatten the curve. Together, we will get through this. Je vous encourage.
I encourage all of you to continue to listen to public health and to do your part to flatten the curve. Together, we will get through this.
Merci. Thank you, Premier. Merci. We'll now go to questions from the media. A reminder to each of the reporters, you have the right to one question and one follow-up. Nous allons maintenant procéder aux questions des journalistes. Un rappel que vous avez droit chacun à une question et un suivi. We'll kick it off with Stephanie Sirois, CHSJ News.
Yes, thank you. This question is for Dr. Russell. Are nursing home deaths from respiratory problems currently being tested for COVID-19?
Sorry, could you repeat the question?
Are nursing home deaths from respiratory problems currently being tested for COVID-19?
I don't have any information on that right now. I haven't heard of that happening, but I can definitely ask about that, but I have not heard that that was happening.
Okay, do you have a follow-up?
I do. This one is for Premier Higgs. There are small businesses who don't currently have loans within the province and are considered essential services. They're operating and looking at layoffs right now. Is there anything being done to immediately address funding difficulties for them?
So any business that is laying off people that are working and living here in the province, we're looking at finding ways to keep those people with financial assistance and do it in a rapid manner, I guess, because we know the federal EI program is well backed up and having difficulties. So we're putting this plan in place. Actually, we're going to be working with the Red Cross in how we implement a financial benefit that gets out in a hurry, treating it like we would in another emergency that would be more physical in nature, and where we would see a quick response from a response organization that is well apt to deliver. Thank you. Savannah Aud, Telegraph Journal.
Hi. So my question is for Dr. Russell. As I'm sure you're aware, as of yesterday, nearly half of Canada's cases are now community transmission. So I'm wondering, because New Brunswick is only testing sick people that have traveled or are in close contact with a traveler, how will we know when we do in fact have a community spread, and how do we know that we don't already?
So that's a very good question. We actually are testing people who haven't traveled at this point to, in fact, look for community transition, so that has started.
Okay, did you have a follow-up?
Yeah, sorry, I couldn't hear that for some reason, but I'll just go back later. So yesterday you both spoke of a plan to gradually test different groups. I'm just wondering, is that for sake of maintaining a good supply, or are there capacity concerns? I know that we've heard the World Health Organization say the key to containing it is to test as much as possible, so why the gradual approach versus just testing maybe all vulnerable groups or all sick people with those symptoms?
So each province has to approach their testing based on where they are in the outbreak management and outbreak response. So as you know, the first case was in Vancouver back in January, and at that time the risks were around travel from Wuhan and then Hubei province and then China and then Iran and then Italy. So as things have evolved from travel-related cases to community transmission, that changes the approach and the testing prioritization based on, again, what the outcomes you're trying to achieve are and based on resources. So those two things are balanced when you're making these decisions. So at this point in time, we will definitely be looking at the community transmission as that evolves in here in this province, and then again changing our approach and basing our next steps and decisions on that. We are expanding our testing capacity and ability, so all the 14 testing centers that were opened in the last week or so are all up and running. They are meeting the demands that we have right now, and so again we're increasing our approach stepwise as the needs unfold.
Thank you. Vicki Hogarth, Charlotte County TV.
Thanks, Dave. My first question is for Dr. Russell. Is there a reason why New Brunswick is lagging behind the other provinces in terms of the number of people we've tested? And do we have a plan to ramp up our testing ability?
So again, as each province has their own response in terms of their own unique situation, each province started at a different time in terms of when they had their first case, and each province would have started with travel-related cases and then community transmission. So we're at an earlier stage in our evolution have things unrolling here in the province. So we expect to see community transmission very soon, and because it's in other provinces, again, that's why we're changing our testing criteria now to include people from who have traveled outside the province. And so again, as we're shifting into that phase of our response, we do have increased capacity with the testing centers and our capabilities with 811 and our online screening tools. So all of these things are building around the next steps in our response.
Thanks. Do you have a follow-up, Vicki?
Yes, the follow-up is for the Premier. President Trump said he's considering loosening the COVID-19 restrictions in the U.S. matter of days even. Are you prepared to tighten the international border as the U.S. considers altering its response to COVID-19?
I'm not sure I heard the whole question. In relation, are we prepared to tighten up our border to the U.S.? Was that the question?
President Trump has said he's considering loosening the COVID-19 restrictions in the U.S. Are you prepared to tighten the international border if they do alter how they're responding?
Yes, we would be. We have no intention of loosening our restrictions in any way. I think that we want to find ways to effectively and have our cross-border trade and commerce moving. We've dealt with the issue in terms of the local issue around Campobello and people to move that way. But as far as people moving in and out of Canada and the U.S. Without it being an essential service or an essential need, we will not be relaxing that anytime soon. Thanks, Vicki. Jean-Philippe Hughes de Radio-Canada.
Yes, so my question is, I think we spoke yesterday about the peak that is expected in 5 weeks. I'd like to know, according to your projections, how many cases could that mean in New Brunswick?
So I think at this point in time, it's hard to predict when the numbers of cases will peak at this time. So I can't speak directly to that. Again, all the measures in place right now are around containment. And so the approach with respect to the borders and self-isolation for travelers, the contact tracing and self-isolation of people who are diagnosed with COVID-19 and contacts of COVID-19, and also the general population. So the fact that we have only people out and about who need to be working, who are essential workers and healthcare workers, et cetera. So what we are doing right now is definitely changing the trajectory of any projections that anybody could have been making thus far. So at the national level, we are tracking that in terms of as each new measure is put in place, what the effect it can have on the number of cases as they increase. So right now in New Brunswick, we're at 18. We expect to see more cases, but we expect to be able to do really rigorous contact tracing and self-isolation around those cases and close contacts. And then again, if we see community transmission, all the measures that are in place right now, quite restrictive measures that are to protect people and protect our healthcare workers, and again, from having the numbers go up exponentially, which can happen. So if we can avoid that steep rise in cases, then we can keep allowing our healthcare providers and our healthcare system to be able to meet the demands as people develop symptoms and require hospitalization and ICU. So that is the ultimate goal of everybody being told to stay home, the ultimate goal of having people wash their hands, the ultimate goal of having people, if they are out and about, social distancing by 2 meters or 6 feet. So the most important things that people can do right now are all of those things that I just mentioned.
Est-ce que tu as suivi, Jean-Philippe?
Do you have a follow-up? Yes, but before that, could you summarize this in French, please? Yes. So the question was on when we would hit peak number of cases in New Brunswick. It's very hard to predict right now. We've taken a lot of measures. And these are measures for people who have to stay home. People can't go to the cinema, can't go to church. Everyone has to stay home. We want to reduce the risk of a rapid increase in cases. And we also want to make sure that we don't go beyond our healthcare system's capacity. We need to be able to treat everyone who needs to be hospitalized in the upcoming weeks and months. Right now, unless they're essential workers who absolutely need to leave, we're asking people to stay home and to self-isolate if they've already been diagnosed with COVID-19, if they're in close contact with someone who has it, if they've traveled outside of the province or of the country. Everyone should be home unless they have to go into work because they're essential workers. All these measures, including washing your hands and to maintain a social distance of 6 feet between yourself and other people, washing your hands. All these measures have been put in place right now to avoid a rapid increase in cases. If we continue to follow all these recommendations, all these things, it's very hard to predict when we'll have a peak number of cases because we're trying to avoid all of that. And this is why these measures are in place right now.
My follow-up is for Mr. Higgs. With Quebec having more than 1,000 cases right now, are you considering closing the border or controlling the border with Quebec the same way Nova Scotia and Prince Edward Island already do?
Yes, we are considering limiting the access crossing of the borders, and we're reviewing that with public safety and with with public health to understand what measures need to be put in place to ensure that it actually makes a difference. You know, it's a case of, do we know where people are going? Do we limit people from going? Do we have some way to track them? So if they're going to a certain location, we know that they're isolating. So it's when we roll it out, and you know, it could come very soon because we're working on it right now. It's a discussion I'll be having again with my colleagues, the other leaders of the other parties tonight. And should we roll it out, the details will be specific and what we expect questions to be asked, what tracking mechanisms we put in place, and what rules are going to be followed.
I don't hear you quite well. Just to make sure, when are you planning these measures?
So I'm meeting tonight with my colleagues on the COVID committee, with the other leaders. We are reviewing with public safety. They are putting a recommendation forward now what that might look like, who the public safety officers and how it is integrated with the RCMP and public safety. And if we did so, working with public health, what actual impact we would see. Because it's more than stopping a car. It's a case of, okay, where are they going and how do we know that's where they're going and they're going to stay? What's the purpose and how do we track it? So I want to know the full gamut of what it means, who we're dealing with particularly, and how it's going to be monitored, and then how effective we expect it to be.
Thank you.
Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. You mentioned earlier that a line was set up yesterday where people can call in. Were the employees at these companies that were violating the rules sent home? It's not clear to me what these officers are doing when they respond to these concerns.
So the So the first exercise was to do the surveillance and understand what is our level of compliance. And we, out of 764 companies that were actually evaluated over the weekend and over the last few days, we found that there was about a 94% compliance. The ones that were identified, the 6% that were not compliant, have been and are being revisited with a warning that this is what's required for you to actually come into compliance. Not being in compliance will either result in penalties related to fines or shutdown of the facility. Additionally, the requirement is that these are facilities that are open because we've allowed them to be open, not because someone just decided they were going to close. We have requirements there, and it's interesting. We've seen Quebec and Ontario, have introduced new measures just today that are very reflective of the measures we've had in place for the last week. But it is important that there's a follow-up. There's a surveillance. There's a compliance requirement, and there's a penalty clause if you're not following the rules. We can all talk about getting better, but sometimes people need more encouragement to do just that.
You have a follow-up, Elizabeth?
Yes. I have a question for Dr. Russell. Under the plan to transfer long-term care patients to hospitals, is it possible that any ALC patients were sent home instead? And is that even an option?
I have only heard about the patients that are being transferred out of the hospitals at this point in time.
Thank you. Silas Brown, Global News.
Hi, Dr. Russell. I'm curious, this has been addressed kind of a couple times today about expanding the criteria of testing. I'm wondering if you could just kind of walk us through what that's going to be expanded to, who's going to be eligible, and what the new rules around testing are going to be.
So as the national criteria have changed in terms of the case definition, that is what we've been following. And so again, when the outbreak started, when the first case was identified here in Canada and BC, the risks were around Wuhan, then Hubei province, then China, et cetera, and expanded globally. And now it's expanded to include people who have traveled anywhere outside of New Brunswick. So that's what's happening now, but we also, again, we're looking for community transmission, so we do have some testing being done on people who have not had contact with a case and who have not traveled, and that's the basis of looking for community transmission. But because we've expanded, again, the case definition, and the case definition is changing at the national level probably again this week, so we'll be talking to our counterparts at Public Health Agency of Canada about that. We have expanded our testing capabilities, so we have 14 testing centers now, and we're able to do all the testing that we need to do around these new the new case definition.
Do you have a follow-up, Silas?
Yeah, if testing of people who have symptoms but haven't traveled is just beginning, you say that we currently have no community spread. What evidence is there of that? What are you basing that on if we're only just starting to test people that have symptoms who haven't traveled?
Well, again, I think in the hospital system, the discretion is there for physicians to have done some of that testing already. So I think there have been cases that have been situations where people who haven't traveled had been tested if they had symptoms, and a clinician felt that it was appropriate. So moving forward, we do have what's called sentinel testing happening. So we have with the RHAs worked on again that ability to do that. And once we shift into the knowledge that we have community transmission, then that will determine that we're in a new phase of our response, and so we will adapt accordingly.
Thank you. Adam Heuris, Brunswick News.
Thank you. Premier Higgs, Ontario Premier Doug Ford announced today that the province will charge customers lower power rates for the next 45 days to offset higher electricity costs as more people are working at home, self-isolating, or have lost their jobs. Is New Brunswick going to do the same thing?
Well, although we already have lower power rates here in New Brunswick and Ontario, we are doing, we have taken some measures to further, I guess, alleviate the costs of power. In relation to the decision that the Utilities Board was putting forward for rate increase, the MB Power asked for that delay, so there will not be any increase for 6 months. We're also deferring electricity bill payments for residential and small business customers for up to 90 days, and basically extending the existing payment arrangements as well. The other item was waiving interest on past due balances and late payment charges issued after March 19th. So MB Power announced these measures a few days ago in relation to alleviating immediate concerns, but also relating, ensuring that these concerns were related to the actual COVID-19 crisis. So we will be responsive to individual needs, and we will ensure that anyone or businesses impacted by this crisis will recognize that, and MB Power has already committed to working with them to ensure that they can keep the power on.
You have a follow-up, Adam?
Yes, please. And so just to clarify, there's no further actions being considered. And then I wanted to ask about the Emergencies Act. You said you have concerns about provinces being able to provide the very same level of health care. Is New Brunswick struggling to deliver what other provinces are delivering? Is that what you're saying?
No, I'm not saying we are. I'm saying I want to be in a position that as the intensity ramps up, and that, every health system in every province is being maxed out or strained to the limit, that we all have the ability to ensure that every citizen in our province has the same access to health care and standards as other provinces, and that includes the patient and the workers in those facilities. And so my concern has always been that we are one of one province of many in Canada, but we need to have a national oversight there to ensure that supplies are available to us, that certainly there's consistency of the standards being met, and that we can ensure our citizens that is real and possible and true. So this is not a current situation. This is a situation that exists, may exist. We're hoping it doesn't. We're hoping the mitigation efforts that we put in place will indeed keep us below the threshold, and our system will be able to manage the way it has for many years, knowing that healthcare systems across the country are challenges in New Brunswick and the same as other provinces.
Just a clarification on power rates, no further action being considered?
Not at this time.
Okay, thank you.
Mathieu Roy-Como, l'Acadie Nouvelle.
Premier Higgs, you just talked about a lot of you aid to small businesses. Is there an amount number, how much of all that could cost, or how much money is being made available for those small businesses?
There is not, Matthew, and the reason is because I want to look at every case. We're analyzing the need, the severity, and the cases, not only for businesses, but for people and the number of people they employ, and keeping those people employed, so that and for the business to be able to start back up and continue employment when this crisis is over. The same logic applies as we look through the other measures that the federal government are putting in place. I know the norm would be, and we see that across the country, where somebody injects some money. And I know federally, when they were talking about the billions of dollars being invested, and then we're trying to get under the hood to figure out, okay, what does that mean? And that's what we're working through right now. Like the quick access to EI, but finding that the system is so overloaded that's not possible. So what we're focused on is the process to deliver a result, and we'll spend the money necessary to get the result.
Est-ce que tu as un suivi, Mathieu?
Oui, s'il vous plaît.
Yes, I have a follow-up.
Is there the fear that New Brunswick might not have the financial means to help its citizens and its businesses as much as other provinces with single funds are doing?
Now, was that we would? Can you repeat the question, Matthew?
Yes, sorry. I was wondering if there's a fear that New Brunswick maybe does not have sufficient funds to help its own businesses and its citizens, like other provinces, richer provinces, are doing with their citizens and their businesses.
Well, I guess, in keeping things in perspective, we know that, and that's the same logic I was having with a national strategy on this crisis. It was so that we all can maintain the same level of capability in dealing with the health concerns. But I feel the same way in dealing with actual business concern. But I do feel comfortable and confident that we can manage this prudently so that we can ensure businesses here can restart in the same manner as they were impacted initially. Our goal is that, it's not a matter of someone getting a windfall out of this. It's a matter of someone not losing their business and not surviving this. So I think we can financially do that. Our budget was one that reflected an ability to deal with emergencies. Yes, it'll mean our budget doesn't look much like it did when it started or when it was approved, but we had a surplus there and we had a debt repayment. We had money there that was for emergencies. Nothing like this, mind you, but I'm comfortable that we had a prudent budget. We can manage that to help people that need it, and that's where the money will be placed.
Laura Brown, CTV News.
Premier, can you tell me if you've decided on a number figure for the fine?
What was that question again, Laura?
Can you tell me if you've decided on a number figure for fines of people or businesses for not complying?
Well, there are, it ranges, and I know there was a top range that was up around $10,000, I think $10,200, and it was a staged fine that would be, first and second and third infraction. So there is a kind of a formula there, but, let's hope we don't get there. But I want people to be convinced that we will invoke the necessary compliance rules, including fines and penalties, including closing down a company, because we will follow the health rules as set out by public health, because it's a must. This is a health concern for all citizens of this province, and it is not only unfair, it's kind of unconscionable that anyone would put others at risk by not following the rules that are genuine health concerns.
Did you have a follow-up, Laura?
Yeah, very quickly. Dr. Russell, I'm sure you're getting a lot of emails and calls about this too, but I'm getting a lot of people asking for clarification when it comes to self-isolating. So this individual is in a multi-unit condo, and he says a lot of snowbirds have returned over the last week, and they're walking around the building, walking pets, generally moving around even just the building during normal times. And this individual is concerned about it. He's wondering what they should be doing, if you could walk us through that.
So anybody who's traveled outside the country and outside the province should be self-isolating in their home and not exposing themselves to others at all. So if you need to get groceries, then somebody needs to drop that off, but you should be inside your home, self-isolating.
Thank you, Doctor. Kevin Bissett, Canadian Press.
Most of my questions have been asked, but I will ask this, Premier. With it becoming this time of the year when the flood season is in the offing, what assurances can you give to residents that the government will be able to address the flooding situation during the COVID outbreak?
Well, we will indeed address it as required. We're watching that very closely, and currently we've had melting conditions that are like a typical March, so we hope that continues. But nevertheless, EMO have been doing the river watch. They're keeping that up to date. We're actually, we'll be prepared to deal with the flood situation. I was in touch with the base commander earlier this week, just talking about their situation and who they have, where the people are stationed. And so the preparations for any event that we could be faced with here, that certainly floods like we've seen before. This situation with the COVID crisis is unique, but we will be prepared and we will do what's necessary to protect our citizens.
Do you have a follow-up, Kevin?
Yeah, do you foresee having to perhaps use the military more this time than perhaps we have in the past?
Well, it's certainly an option available to us. I was very pleased with their participation last year. So if you say, do I foresee it, I'd like to foresee not needing them at all. And that's what I'm going to stick to at this point. But it's nice to know they're there when we need them.
Thank you. Fadil Ibrahim, CBC.
Yes, thank you. This is a question for Dr. Russell. We see some people on social media are saying they're gathering personal protective equipment to donate them to hospitals. What kind of equipment would be appropriate to donate or give to the healthcare system, and what are the rules around that? So what kind of seal should be on there?
My understanding right now is I think that New Brunswick Medical Society has a way for people to make donations, and they would have the criteria around that, is my understanding.
Do you have a follow-up, Adil?
Yes, so we've heard the health authorities say that the province has 161 ventilators and more are on order. How and where do we get more ventilators during a global pandemic, and have any new machines arrived?
So the folks who are working on procuring those, I don't have the details in terms of the timelines. I just know that they have been ordered, and I can definitely come back to you with that information in terms of the exact timing. I just know that the process has been put in place to make that happen.
Thank you.
Thank you. David Caron, Acadie Nouvelle.
Oui, bonjour.
Yes, hi, how are you? Yes.
Higgs. So, it's been said that in Quebec, one of the essential services is seafood processing because, the fisheries, the snow crab fisheries are set to open later this week. So the processing is, an important process of it, and it's considered essential. And so we know that in New Brunswick, it's set to begin in a couple of weeks, or they hope to. So I'm just wondering what the province's stance is on fish processing, given that it's an important employer for a number of people who only work seasonal jobs and so on and so forth. So I just want to know what the province's take on that is.
Well, food processing we would consider an essential service as well, and I guess it'll come down to the case of being able to do it under the public health guidelines and the safe distancing practices, and wearing appropriate equipment. I know that issue was brought up in relation to foreign workers and having the accessibility of people to be able to work as well. So, but my goal right now would be to be able to find a way that business could start up seasonally as it normally does, and a way to operate it safely.
Est-ce que tu as suivi, David?
Do you have a follow-up? I don't think so. Thank you.
Rickard, CBC.
My questions are for the Premier. What was the message sent to veterinarians over the weekend about what services they can provide?
It's a good question. I do not know what sense, but I don't think it was counted as an essential service, but I do not know that. I'll get that answer and respond to you.
Okay. Did you have a follow-up, Mia?
I do. There seems to be some confusion over whether people can go to the urban nature park, for example. Are they allowed to go to parks, and if so, what rules do they have to follow?
So it depends on if somebody's supposed to be self-isolating or self-monitoring. People who are instructed to self-isolate really need to stay at home, and they can take a breath of fresh air out in their yard or what have you. For my understanding is it's being discouraged to travel to nature parks, et cetera, in terms of using facilities and whatnot. But if somebody's just being told to self-monitor and they're walking and they're keeping themselves 2 meters apart from somebody or 6 feet apart from somebody, my understanding is that it's okay to go for a walk.
So that concludes today's summary. Bonjour, merci.